Okay. What I'd like to discuss a little bit today, since this has been our priority here at the QCS Relief Crisis Center, is the medical and the effect that the earthquake had on the whole medical sector here in the country. We had pretty close to 85% of the hospitals damaged or destroyed within the city. And we in the center have concentrated on bringing doctors in. We have doctors from over 9 nations working 24/7 in the hospitals that we were able to open with medical supplies, mostly ortho to start off with, but the trauma part is down now, and now we're going into the long-term medical care. But one of the major issues in a crisis such as this that happens to developing countries is with the tremendous influx of pharmaceuticals and doctors that come, is to be sensitive not to destroy the whole infrastructure of the medical field. Hospitals that are for-profit have been working as non-profit hospitals right now, and they cannot continue to do so. And we could easily bankrupt hospitals and pharmaceutical distributors and all of these folks, which is not the intent long-term. Our objective is long-term here in Haiti, because we're all here and we're working hand in hand with the local medical, public sector and private sector to try to find a way to where that they're not so swamped with medications and doctors that they're unable to function once everyone begins to leave, as will be the case. And whatever it is that is planned for long-term has to be extremely sensitive. I've been here many, many years and have seen efforts, while with a good heart and a good spirit, not think through the solutions of long-term, and have actually hurt different sectors more than they helped by just taking over everything, and then when they leave, it's just a big vacuum. So my suggestion, and what I've worked with many of the hospitals, Chicago Community Hospital and some that sent large groups down, is for within the United States to have some kind of a partnership. Our hospitals here are very small, 30, 40 rooms, partially destroyed, so they even have less, is to work on some form of partnership that over a period of 5 years, the medical field here, the equipment, the hospitals, and everything like that, that were already poorly equipped before, can actually be better than they were prior to the earthquake. This is extremely, extremely important to us in doing this. So that's our main focus in the medical field. Provide the care, provide the meds that are needed, but work in collaboration with the local market, within the local market private sector's ability to remain profitable, so that they can in turn still function after the crisis is over. And the same will be in building. When we get into logistics and to building homes and all of this, we need a lot of help in deciding. Haiti has historically not had any building, even though that there is supposed to be some form of building codes, but they have never been implemented, and we need to begin to look at rebuilding whatever is going to be rebuilt under earthquake norms that are much more stringent, and to work with the local engineering firms and architectural firms to work partnering with them, not to take over, so that these can remain intact and stronger once the crisis is over. So these are our focus here. We're here for the long term. Medical, then the logistics. Food distribution and water distribution, we feel need to be handled by the international organizations that are structured for that can move volumes of food and water in secure situations, which the private sector has a little difficulty doing. So in the analysis that's going on in these crises, you have to really work with the local infrastructure if you want a long-lasting and long-term positive result, so that a vacuum isn't created after the big nations with all of their supplies and all of their manpower leave, that we haven't created a vacuum that is unable to be filled by the local market here. So in all considerations, both medical and logistics in houses, this has to be a key factor in working with the people here. Doctors are much needed here. Engineers are needed, but they're also needed to work in collaboration and partnering with the firms that are established here, helping to strengthen them for the future. Because a country like Haiti, where everything revolved around Port-au-Prince, the infrastructure of the country has been totally destroyed. It's to redo. I've heard statistics that from people who have done these studies that Haiti has been set back 40 to 50 years by what has happened. Yet, in my opinion, I don't think they need to be set back, because if we can join forces together, we can actually turn a negative into a positive when done with the right structure and the right long-term planning.
Thank you very much.
You're welcome.